Welcome back. Now, the U.S. President Donald Trump's decision to halt foreign aid to foreign countries, especially developing countries, over the next 3 months will hurt lives around the world immensely. Namibia is one of the countries that has been receiving aid from the U.S., most notably in the health sector through the Presidency Emergency Plan for AIDS Relief, known in short as PEPFAR, as well as USAID. Now, the Minister of Health and Social Services in Namibia, Dr. Kalumbi Shangula, now joins us telephonically to discuss the possible impact of this decision on Namibia. Good morning, Minister, and welcome to the program.
Good morning, and good morning to the viewers.
Okay. Now, Minister, with the announcement that foreign assistance will be suspended for 90 days, and that Namibia being one of the recipients of U.S. aid, in what ways will this affect Namibia's ongoing programs and, these continuous rolling programs that we currently have?
Yes, thank you very much for that question. Yes, indeed, as you correctly stated, that the President of the United States of America issued an executive order suspending aid to foreign countries for 90 days pending review. Yeah, in other words, this is an interim measure while they are trying to put their house in order. That's how I understand it. It's not a permanent ban. Now, yes, indeed, this was expected because, first of all, he withdrew the USA from the World Health Organization, and the World Health Organization is one of the specialized agencies of the United Nations Organization in the field of health, and the withdrawal from the WHO means that the U.S. contribution to the WHO budget is also withdrawn, which will leave a gap and which will impact on the operation of the World Health Organization. As far as Namibia is concerned, we have got cooperative agreement with the United States of America. It's one of our development cooperating partners, a very important one in terms of the contribution to our activities. And obviously, that suspension will also have an impact on Namibia as a whole. But I will want to go deeper so that we have a better understanding of its impact on the operation of the Ministry of Health and Social Services.
Okay. Now, Doctor, we understand that the ministry doesn't obviously directly manage the funds that are coming into Namibia, but agencies established by the U.S. over manages these funds. But how will this impact the collaboration, and how would we ensure that obviously Namibia is not impacted by this decision? Earlier this morning, me and my colleague were discussing the fact that sort of the interim order that is in place appears to be there's some sort of retraction, especially when it comes to organizations within the U.S., but not necessarily for those that are outside the U.S. So are we saying that we are secure in terms of medical supplies and we are not likely to be affected? And we are also hearing that ongoing programs or medications that have been bought with U.S. funding, we understand, should not be distributed during the interim. Is there any correctness in these allegations?
Yeah, let me just thank you. I can't hear you now.
No, I can hear you now, Doctor.
Okay. Yeah, let me just explain the scenario we have. All the United States of America is mostly supporting a program related to HIV/AIDS, TB, and malaria. And it's mostly in the area of advocacy, prevention, system strengthening, and human resource capacitation. Now, let me first put it into context. The health programs, they are in Namibia, they are funded by the taxpayer. if I can give you an example. During the budget last year in the National Assembly, I tabled the budget of the Ministry of Health and Social Services for the activities which we are going to undertake. There are mainly two programs. That is the program for curative and clinical health services. That is basically treatment, diagnosis, etc. Now, that budget for program amounts to 10,120,598,000 Namibian dollars. 10 billion. And then the second program is the public health, which include prevention. That amount to 100,794,000 Namibia dollar. So that is the money which the parliament has appropriated to the activities in the field of health. So it is a big chunk. It's more than 10 billion Namibia dollar. Now, what do we do with that amount? With that amount, we buy the medicine, we buy the diagnostics, and many other things related to curative services. And for the public health, that amount of money, we buy the insecticide to kill mosquitoes and many other activities. And during the budget review, we asked on additional 250 million Namibia dollar, which was given. The whole of curative is the responsibility of government, and that money has been appropriated by Parliament. When we started our program, for example, I noted that at the beginning you mentioned the reduction in mother-to-child HIV transmission. That is a program which was started entirely by government in 2002 without any external help, and that is taking place in a clinical setting, being managed by the staff of the Ministry of Health and Social Services and being implemented by them. So the point I want to make is that the major portion of the health activities in Namibia is funded by taxpayer. We have many development cooperating partners, including the Global Fund, including PEPFAR, and also some agencies like UNAID, and they all make contribution to the efforts of the ministry. But the impact of the decision is mostly pronounced in the non-governmental organizations because there are activities which are being carried out by non-governmental organizations in the field of advocacy, in the field of care, which are directly funded through PEPFAR or through UNAID. And those ones will be impacted. But as for the programs for treatment, that one will not be impacted because there is no contribution into that direction. We have, for the antiretroviral medicine, for example, we have a contract running already which has been adjudicated by the Central Procurement Board, running over a period of 2 years, and we are getting our constant supply of antiretroviral medicine without any problem, and that process will continue. It will not be impacted at all.
Brilliant, Doctor. I think thank you for putting that on record, just to indicate that the sustaining of malaria, for instance, TB and HIV programs, in Namibia will continue besides this interim order that the U.S. President has indicated, and that this is only likely in most cases to impact the various civil societies and organizations that work to complement the Ministry of Health and Social Services activities. Now, speaking about sustainability, Doctor, perhaps the malaria, TB and HIV programs that were funded by the ministry without external support, which you also indicated, have been receiving, parliamentary allocation, and also indicated that there's been substantial allocation again from the midterm budget review. Let's talk about how you've been sustaining these programs that have been funded by taxpayers.
Well, the sustainability is assured.
Doctor?
Sorry, I missed you. I was not hearing you.
No, you can go ahead, Doctor. I think it was just a line cut, but we can hear you.
Okay. I was saying that the sustainability is one of important consideration of the ministry, because when we are working with the developing cooperating partner, our policy is that you come and then you say, I need to assist you, tell me where I can assist you. And we will be in a position to tell you that we lack capacity in this area or that area. So please, you can channel your support in this direction. We are doing so that in the event that the donor or the cooperative partner is unable to continue, the ministry will be in a position to take over those activities, to take over those responsibilities. Because we believe that it is not good to create expectation and then in the end you are not able to carry on with that expectation. And the sustainability of our program lies in the fact that it's grounded in the government budget cycle and budget system. Every year we budgeted for these activities and Parliament appropriate the necessary funds to those activities. So there we have ensured the sustainability, because the government is concerned with its citizens, and the government will always ensure that the needs of the citizens are addressed. It is in that light that the activities in the health sector will always receive government priority.
Now, again, building on the question that you have just answered, Doctor, we know that Namibia not having a program solely funded by external donors, like some countries who have programs funded up to 90% by external forces, obviously, which undermines the sustainability of those events in the case of where such an interim order like now is being given by Donald Trump comes into such a position. What makes Namibia so unique that it doesn't find itself in this tight position, other than, the necessary appropriation of funds that is being given by government?
Yeah, I in that aspect, I must say that Namibia is really in a very fortunate and unique situation. And maybe the genesis of this is the fact that Namibia has been classified as an upper middle income country, which does not receive so to say, favor or anything, and it helped Namibia to stand on its own feet. And that is a positive thing, that Namibia always makes sure that everything we have to carry out must be part of the government program, and it must receive appropriation from the parliament. And that's the most fortunate part for Namibia. And it also maybe stems from the fact that we have learned that we need to stand on our own feet if we need to progress.
Indeed. Now, we know that some non-governmental organizations have trained quite a number of nurses to care for TB and HIV patients. What is likely to happen to them should this interim order not be rescinded by the Trump presidency? Will the ministry likely find a way to absorb them, or will they be incorporated into the system, or are they already part of the system? Or what is the ministry's thinking? Because, we did talk about the fact that we are also lacking adequately trained nurses, seeing that also some of our longer-serving nurses have also gone into retirement, and we'll need more experienced nurses to train the oncoming nurses that are just coming from graduation school.
Yes, the function of the training institution is simply to train. And then after they train, the trainees, they go into the job market to look for employment. It is not necessary that everybody who is trained should be absorbed in the public sector. There is also the private sector, which also need human resource for health. The ministry has gotten a start on approved staff establishment, which actually define how many doctors, nurses, pharmacists, physiotherapists, etc., the ministry must have. And we periodically advertise vacancies when they occur. As you rightly said, that there is a natural progression. Some people will go into retirement, and then the vacancy arrives. And then we look from those ones who have been trained, and then they can apply. And then if there are vacancies available, they can be absorbed. Now, of late, we have seen that there has been a big demand for health professionals in the public sector. The population has obviously increased, as we have seen from the latest census that we have now, above 3 million. The disease profile has been changing, and new health emergencies are occurring. So there has been a need for more health care personnel in the public sector. End of last year, we have gone on a recruitment drive. Positions were advertised and applications were invited. We are still in the process of completing that process. But so far, for example, we have recruited additional 40 doctors for Shakati Hospital, 11 doctors for Rundu, and the process is ongoing. So the point I want to make is that there will always be a need for health personnel in the public sector, especially in the Ministry of Health and Social Services. And as soon as the vacancies arises and the fundings are available, we will continue to recruit.
Doctor, as we conclude to wrap up our conversation this morning, I know you did indicate that the government continues to be in a position to continue that it will buy the necessary medication, ensure those that are supplied. Maybe perhaps it's a message of reassurance to the nation who are in terms of skepticism that is going around to say majority of government programs that are currently being rolled out are funded by taxpayers, and that Namibia is not in a tight position, and that the Namibian government will continue to ensure that programs are ongoing despite this interim measure that is being put in place by the U.S. government and mostly affecting NGOs and CBOs that are working in collaboration with the ministry in the health sector.
Yes.
Can you hear? We can hear you now.
Okay. Yes, indeed. I just want to inform the public that we should also get to know in more details. Maybe it is our fault that we do not explain to the public what the government is doing, and mostly the external support is only the one which is being projected in the public. But we want to inform you that what the government is doing in the health sector is more than what we can think of. I mentioned about more than 10 billion the Parliament has given to the Ministry of Health just for 2 programs, that is for the treatment and for the prevention. And we are carrying out those activities irrespective of whatever happened elsewhere in the world. So those activities will be carried out. And I can assure you, as far as the ARVs are concerned, these are funded by the government, and we have a contract in place, and we get supply as and when we need it. We have no issue in that aspect. When it comes to prevention, we will continue with the spraying of mosquitoes, but as I said, we also welcome the complementation from the donors, from the development cooperating partners, as they have been doing in the areas of prevention, advocacy, and health system strengthening. And I must also say that this temporary measure, which has been announced pending review for 90 days, I have confidence that most of these fundings will resume. When we have listened to the President's speech during the inauguration, he has indicated the areas where there are concerns, and only those may be impacted. But I am confident that the majority of the activities which are being carried out in Namibia under PEPFAR, for example, funding will resume after the review after 90 days. We should not be unnecessarily apprehensive about what has been announced. We will remain calm, and I'm sure I'm sure that things will not turn out to be detrimental to the just cause of the people of the world.
Well, Dr. Kalumbi Shangula, thank you very much for making time to speak to us this morning.
Most welcome, and thank you very much for the opportunity.